I request all of you to please turn on your camera. Also about ICS works in two department, one-to-one counseling department and second is a training department. So today we have the webinar and I request all of you to be there till the end. How to get the certificate procedure we would be sharing at the end of the session. Now coming to the trainer part, her name is Arpita and she's going to take the webinar for today.
Hello, everyone. I hope I'm audible and visible to all of you. A very good evening to each one of you. Very good evening. I hope all of you are doing well. A warm welcome to each one of you in today's webinar on the benefits of psychotherapy for healthy minds and healthy lives. Myself, Arpita Roy. Today, I'm going to facilitate today's webinar. So, I'm an RCI licensed clinical and rehabilitation psychologist. And I'm having multidisciplinary experience as I have been working in both academic as well as the clinical fields for past 10 years. It includes a lot of neuropsychiatric clinics, psychological treatment centers, de-addiction cum rehabilitation centers, audiovisual production house, where I have been associated as personality development counselor. I also have been a part of the National Trust. You might have heard of it. It's a government welfare body for autism, cerebral palsy, and mental retardation. And also have been associated with schools and NGOs. So obviously, while working in these areas, I have dealt with so many clients and I have actually seen how they are benefiting from psychotherapy and how it is helping them with a better mindset or a healthy mind or healthy lives. So with regard to that only in detail, we are going to cover in today's session. I have also been a former lecturer at the University of Calcutta, clinical psychologist at a government university, and I'm having experience in working with clients having organic disease, mood and anxiety disorder, schizophrenia, personality disorder, mental retardation, and childhood disorders. I also give family and marriage or couple counseling where both premarital and postmarital difficulties are being dealt. So they are not suffering from any disorder. There also therapy is required. I have also worked with special conditions like deliberate self-harm, bereavement, substance abuse, and learning disability. And I also carry out with LGBTQ counseling or queer affirmative therapy. I am an expert in conducting psychometric assessments for adults as well as children. And I'm a trained psychotherapist, and I use my experience in customizing different therapies, which includes REBT, CBT, DBT, MET, play therapy, supportive psychotherapy, and SFBT with clients. Apart from that, I'm holding a lot of courses and other webinars also here at RCS. So once again, a warm welcome to each one of you. So before we move ahead further with the topic, I would like to see how many of you are there who have joined in for today's session, who are coming from a different background rather than psychology. Can you please raise your hand, or you can also put it up in the chat box? Just mentioning your field so that I'm able to connect with you better. Accordingly, I'll go ahead with the explanation to make sure everybody is getting to understand and gaining benefit from today's discussion. If you can mention from which field you are, it will help me to connect with you better. Accordingly, I'll go ahead with the explanation. One of you have joined in from the field of law and BTech, clinical psychology, homemaker, okay, admin background, technical background, okay. I would also like to hear from others. I'd like to keep the session very much interesting, not in a lecture method, but in a discussion mode. You can also come up with your doubts, question, queries. You can drop in your messages in the chat box. I would definitely take those up as well. Homemaker, many of you are coming from teaching background, law. Okay, fine. So keeping this thing in mind, what we are getting to understand is we are here having a mixed group. That's great. So keeping that in mind, let us proceed. Now, when we are talking about psychotherapy, so somewhat we are having an idea, yeah, it's something like counseling or like therapy that patients require when they suffer from psychological problems, something like this. Right. Now, many people are also having a lot of myths with regard to this. Right. So, keeping those things in mind, we are going to cover a wide aspect of areas related to this topic. So the topics that we are going to cover today would include first, what is psychotherapy so that everybody gets to understand and having a clarity about it so that you can also approach if needed or you can guide someone whom you think it is necessary for that person to go through therapy. We're going to discuss about bursting myths about psychotherapy, the goals of psychotherapy, the techniques that we use, the types and its application, how to apply them, understanding how it benefits in healthy minds and healthy body. And also there are limitations that we are going to discuss. So these are the various areas we are going to cover for today's session. Now, let us start with discussing what is psychotherapy. Now, when we are talking about what is psychotherapy, a lot of people are having a lot of different, answer to this. Many would be putting it in a correct way. Many are having a lot of myths. Can you all tell me what are the common myths that we see people have with regard to psychotherapy? You can just type in here. Like I'll help you out. Few people would say that, it is for mad people, somebody who is mad, insane, somebody whose brain is not working, somebody who suffers from some major psychiatric disorder or personality disorder. It's like taking medicine or anybody can do it. These are some common myths. Let me hear what all other myths you people have come across.
Hello. Hello.
Yeah.
Yeah.
Yes.
So, as per my understanding,
Mm.
psychotherapy requires for those who are struggling, decision making and mood swings, and the person who has some, mental challenges like social anxiety or like the unknown fear or maybe like decision making,
Mm.
and maybe like it's also for those people who are deep deep rooted with some lifelong traumas,
Okay.
and those people who are struggling with their traumas which has happened with them in their childhood or maybe like in adulthood, and somehow they are not able to recover for those traumas. So I think those people need this psychotherapy.
Absolutely on point. Great. Yes. Yeah. I think Anita would like to share. Yeah, please go with it.
गुड इवनिंग मैम।
Good evening.
मेरे हिसाब से साइकोथेरेपी उन लोगों के लिए रिक्वायर्ड है जिन्हें
Mm.
की है ना साइकोलॉजिकल प्रॉब्लम है, जैसे कि वो है ना, जैसे सर ने अभी जो कहा था, एक्चुअली मैं भी वही कहना चाहती थी कि है ना वो जिससे कि है ना अलग अलग चीजों से है ना परेशान है, मेंटली परेशान है, चाहे उन्हें
Okay.
एंगर हो, चाहे वो किसी न किसी बीमारी से ग्रसित हो, उन्हीं सभी को साइकोथेरेपी रिक्वायर्ड है अकॉर्डिंग टू मी।
Oh, okay. Yes. Yeah, I can see another hand. You can also go ahead. Yeah.
Yeah, good evening, ma'am. So you're asking about the myth, right? So what are the myths?
Yes.
Yeah. So many people think the psychotherapy is only for the people who is lazy. I mean, only mentally disturbed people or who are having depression. These people have to have this therapy. So I myth we are most of the people are thinking that only the psycho people should have the psychotherapy. I think that's the myth.
Okay. Okay, one of you have shared myth is therapy is only for severe mental illness. Yeah, this is the biggest myth. So people often say, am I suffering from some psychiatric disorder that I will take therapy? This is the biggest exclamation that they give. And whenever you would see that you are suggesting someone, why don't you go for therapy? They would get irritated. They would get angry. Like, how dare you say that? Even you will see in case of students or teenagers, if any teacher is suggesting, why don't you, take your child to a therapist or maybe to the school psychologist, a child is being suggested, parents get angry on that. Ma'am, how do you say that my child is not normal? Now, coming to the point, psychotherapy is not about normal or abnormal. Just like you go to doctors for physical checkup, for physical health, same goes for psychotherapy. Mental health is also health. When we meet someone, okay, we ask, how are you? That's the first thing that we ask people. How are you doing? People are like, yeah, I'm doing fine, or no, I'm not feeling good, I'm suffering from fever. They focus only on the physical aspect. But health does not mean only I'm physically doing fine or not. Health means mental health as well as the physical health. So see, these two things are not separate. It's a combined thing. For example, I'm feeling very low and depressed. So obviously, I'll not feel like going out. I'll feel lethargic. I'll not feel like eating my favorite food also. I'll not feel like communicating with people. I'll feel irritated. I might have cramps, headache. So it is affecting my physical health. So if my mental health is not fine, it will affect our physical health and vice versa. So this is a treatment process which everybody requires, irrespective of you are suffering from quote unquote some psychiatric disorder. So this is exclusively not for disorder patients. Talking about the myths, people will come up myths like this can be done by anybody. He is my son, so I'm the mother, so I would understand him better, so I can be the therapist. Oh, she is our elder sister, she will be able to do it. I'm his spouse, so I know him inside and inside out, so I'll be able to do it. No, it's not about I know the person, so I will be able to do the therapy. Instead, it is about a professional relationship with a trained counselor. They use professional techniques. Yes, another myth one of you have shared, therapist will judge me. Yes, therapists don't judge their clients. Therapy is a safe and comfortable place where you can open up in the way you want. In a non-judgmental, non-biased way, it's a very safe place. You can say X, Y, Z, anything you wish to. Many people also think therapy is just as advice giving. Anybody who can speak softly, politely, they can give advice. So no, therapy is not advice giving only. Generally, we see people who come for therapy, they are lacking on some skills. So we would like to develop on those skills so that the client is getting equipped and they're able to carry out with it themselves. So therapy doesn't go ahead with lifelong. Like I start taking therapy, I will become dependent on therapy. No. So therapy is not about making the person dependent. So let us now then go ahead with the definition wise. Psychotherapy is defined as the informed and planful application of techniques which are derived from established psychological principles by persons who are qualified through training and experience to understand these principles and to apply these techniques with the intention of assisting the individuals to modify such personal, characteristics as feelings, values, attitudes, and behaviors which are judged by the therapist to be maladaptive. Something which is not proper, only be able to deal with those parts. Now, many people also think if I go to the therapist will say this thing is bad in you, that thing is bad in you, and will try to change me. No, therapy doesn't mean that therapist will try to change you. Anything that is faulty or maladaptive in you, only that part the therapist will try to target. So the term psychotherapy, two words are there, okay? This is derived from the ancient Greek word psyche, meaning the breath, the spirit, the soul, the mind, and the therapia, meaning the healing or the medical treatment. So from this, again, it is proved this is not something which can be done by anybody and everybody, only by trained profession. Now, many people are also having a thought like, why do therapists charge us? Like we have to give the fees to therapists, right? On a regular basis, I take up clients online as well as offline. So often I have come across this. Ma'am, only for talking you would be charging. You don't prescribe medicine. No, therapy does not mean that I will be prescribing medicine. And that's a good thing that I'm not prescribing because everybody does not need psychiatric medicine. This is also a myth people have. They do not understand the difference between a psychiatrist and the psychotherapist. Everybody don't require medicine. Many people fear that I will get the tag of a psychiatric medicine. I take psychiatric medicine, so they don't go. You don't need. Therapy can cure a lot of things. But if left like that, it may develop to a huge severity where you might in future have to take psychiatric medicine. But it's not at all must for everybody. Now, why do people ask, like, I will have to pay for talking to you? It's not simple talking or it's not simple chit-chat session. It's a talk therapy. Many people also have this question that just by talking, I will be able to solve my problem. Yes, many things like that actually solve. For example, you will have to change your behavior in a particular. For example, you are like, I'm addicted to something. For example, you are suffering from anxiety. You're starting to panic. For example, you are having some other associated problems. There, actually, therapy will work. Because you're lacking the coping skills. For example, like just a while ago, one of you were mentioning that when an individual goes through some difficult situations and traumatic situation, XYZ, exactly for those situations as well, therapy will be helping us. Why will I make myself dependent on pills when I can learn to cope with the therapy? So what would be the goals for psychotherapy? Take a look. This would be the goals of psychotherapy. So now you can understand so many benefits we would be getting if we are able to involve an individual. And definitely this is going to help an individual with the well-being with regard to the mental as well as the physical health. So for this, an individual will be able to achieve remission of symptoms, to mediate the disturbed pattern of their behaviors, to strengthen the ego, to improve growth and development of the client. Now see, many people, for example, I suffer from lack of confidence. So whenever I have to meet someone, I become very anxious. And how do I cope? I take alcohol. Once I take alcohol, I'm feeling so light and confident. So is that the correct way of coping? No, I'm getting addicted to it. Whenever I'm into some stressful situation, I start smoking. Is that the correct way of coping? That means I'm not able to deal with my anxiety. Again, therapy will be the way out. To protect self-esteem of the client, it is going to benefit. To produce deeper insight into the issues the client is facing. To modify deviated personality, to develop positive attitude, and to correct psychopathology, if any. One of you asked to explain strengthening ego. Strengthening ego in the sense your self-esteem, your self-confidence, how you are perceiving yourself, that part. So if these areas are being corrected, obviously, it is going to benefit my mental health as well as my physical health. Now, what all techniques are being used in a therapy session? Often clients are curious. So yeah, ma'am, you will be just talking. For that, you will be charging this much. So no, I'm not talking only. These are the opportunities you are getting. These are the techniques that are being used by a psychotherapist to benefit you mentally and physically. You will be able to ventilate in the session. There are many a time, lot of things are there. We are suppressing, and that leads to problem. So we need to ventilate. Otherwise, that may develop some other problems. So yeah, therapy is the greatest place where we can share on those areas. Abreaction, that means expressing something in a proper way without using any censor. You are able to get that opportunity. It's a safe, non-judgmental, unbiased way. Reassurance, sometimes a client need a little bit of reassurance. Ma'am, okay, I will be fine, no? So yes, you will be fine. That's the thing. Yeah, just a second. Now, a lot of things also client find it difficult to understand what is happening and what not, how it is going to help. So we also help them with explanation. Certain times suggestion is also necessary. So that also they're getting from the profession. Persuasion, reinforcing some positive behavior so that they are repeating that again. Reaction, dealing with those areas, and relaxation is also very important. For example, you're suffering from fear, phobia, anxiety, panic, stress, you are not able to relax. So that is also a very important part. Now, people again have a question. How will I understand when I need therapy? Right. So, according to the type of psychotherapy, if we talk about the format, we can either go ahead with individual therapy or group therapy or family therapy or marital therapy or community or milieu therapy as and when required. So now many people would be asking, or maybe psychology aspirants would be asking, which type of therapy is a good option? All are good options. Depending upon the type of the problem, type of the issue you are facing, we will have to choose from these techniques. According to the content, the applied personality theory, we might go ahead with supportive therapy or expressive or insight or dynamic or insight-oriented therapy or behavior therapy, biofeedback, cognitive behavioral approach, experiential approach, or rehabilitation and activity therapies. So now, is it possible for any person who know you well for that person to give therapy? Obviously, a person who is not from this field, not trained in this area as well, never ever be able to go ahead with this once. So let us discuss more in detail with the types, and it will also help us to understand how it is going to benefit us mentally and physically. So talking about the definition and aims, so it is the form of therapy, like if we talk about the supportive psychotherapy, it is the form of therapy that deals with conscious conflicts and current problem maybe the client is facing. And it is going to aim at supporting the patient and helping them to relieve the symptoms and resolve the problems. As I mentioned, everybody does not need medicine. So maybe with supportive psychotherapy, you are able to deal with it. So if your mind is getting calmer and you are able to learn to cope up with the situation, obviously it is not going to also affect your physical health. You will be able to regain the equilibrium and maintain stability. Equilibrium means, for example, something very stressful and very tragic incident has taken place in your life. So what will happen? Previously, you were in a balanced state, so it will get disbalanced. So once you join for the therapy, again, you are gaining the balance. So obviously, it can be done with therapy. You will be also able to achieve a better adaptation, better coping, and better functioning, which was otherwise not possible for you. So when can we use this? We can use it for crisis situation. We can use this for very like acute distress or adjustment disorders, chronic or handicapped patients, or for patients who do not need or do not fit for deeper expressive therapy. Or for example, somebody is being diagnosed with a life-threatening disease. Oh my God, that's a stressful thing. How will I manage? So again, I will not say you take a pill. No, you take therapy. So that would be helping the individuals. So how does it help? We are saying it helps. How does it help? So yes, again, here we are using the professional techniques that is going to benefit the individual mentally and physically. So we will help in establishing an empathetic understanding of the relationship. We don't sympathize with the client. Oh, I'm feeling so bad for you. No, the society people are there to do that. So we are like, I am keeping myself in the client's shoes and from that point of view and feeling with the client, being with the client so that the client doesn't feel I'm all alone and how will I do it? Actively listening, empathetic listening, reassurance and encouragement. In certain cases where we find that the client is not in a state to understand or go ahead with the things, we give them suggestion, advice, we persuade them to follow certain things. We help them with clarification and explanation if they are lacking in knowledge or information in certain areas. As regards symptoms, interpersonal problems, and ways of coping. We try to strengthen how they would be using proper defenses or proper ways of coping. Suppression of unwanted conflicts. Improving the ego strength and functioning, so that they are again able to develop a better reality sense, reality testing, autonomy, and many other related areas. Environmental manipulation and modification, so that they feel better, and helping in improving insight, a better understanding, and a better reality sense. So this is how we can go ahead. Next, if we talk about the psychodynamic or expressive therapy approach, with the help of this, we will help an individual to uncover the unconscious conflicts that they might be having. So if there are some unconscious conflicts or something that is there deep down the unconscious, it will some or the other way come out in the client's behavior, emotion, and may lead to some other maladjustments also. So we will be resolving on that part. So again, therapy would be able to do that. We will be helping the patients to resolve the conflicts and correct the deficits through understanding and insight. Induce change in motivated by insight, corrective relational and emotional experiences with the therapist can do that thing. Now, when we are talking about behavioral therapies, so yes, many a time people say, ma'am, I am having this behavior for so many years. Is it possible to change? I don't think so. But behavior therapy mentions it is possible. It mentions that it is a behavior which is wrong and you have learned that wrong behavior. So, as per the school of behaviorism, it mentions if you have learned something wrong, you can unlearn and you can relearn the positive ways of behavior. So, it is possible to change. How? Using behavior therapies. So, here also there are techniques the therapist may be guiding the client with. So, behavioral therapy is based on the therapy that symptoms are persistent, maladaptive behaviors acquired by conditioning or learning. It got conditioned, and that's how you have been doing it for so many years. So, therapy consists of deconditioning or unlearning of such behavioral habits. Just now I mentioned, and relearning the new adaptive behaviors. For example, fear, phobia. So, we are learning. So, here also, therapists would be explaining the client and helping the client with different techniques. There are a lot of techniques which the therapist can choose depending upon the client's type of problem, like systematic desensitization, which is used to treat fear, phobia, anxiety, graded exposure, flooding. These are also some techniques to treat with fear. We can use aversive conditioning to treat with alcoholism or some other addictive behaviors. We can use reinforcement. We can use modeling technique where the client will be observing and learning. And there are so many other techniques under behavioral therapy where the therapist will be using. Coming to the next part. Just a while ago, we were discussing, if I feel low and depressed. And nowadays, this is a very common term. Ma'am, I am feeling depressed. So, depression. So, here, something is there with regard to the client's mind. Why am I feeling depressed? So, for that, we can also use cognitive behavior therapy. So, this is not only for depression. Anything with regard to thoughts, if you are having a wrong or a faulty thought, it will affect your emotions as well as behavior. So what are we discussing about today? We are discussing about healthy mind, healthy body using psychotherapy. So CBT or cognitive behavior therapy is a wonderful option for that. Here also at ICS, we are having a detailed, course on this, a certificate course. One of you have asked how to recognize faulty thoughts. Yes, there are also techniques for that. So this therapy is based on the theory that a person's affect and behavior are largely determined by the way they in which they cognitively go ahead with thinking in a particular way. They have their structures, their interpretations of the world. So when they are faced with a situation, they respond with certain immediate interpretations. These are called automatic thoughts, which are highly influenced by underlying or hidden beliefs or assumptions. So just now the question that was asked, how can we identify or recognize the faulty thoughts? By communicating with the client, what all automatic thought a client is having because of a particular situation, therapist is getting to understand. For example, I'm talking to my therapist and I'm saying, ma'am, today I'm not feeling good since the morning. My therapist would be asking, can you tell me what all things you have done since morning? What has happened? I'm saying, yeah, the day started normally and I didn't have office today, so I was little getting bored. I called one of my friend. I wanted to talk to her, but she disconnected my call. And now it's been 4 or 5 hours. She has not also texted and not also called me back. Then my therapist is like, okay, so what kind of thoughts came to your mind? Ma'am, I think she is like avoiding me on purpose. I think she dislikes me. I fear other friends may also start rejecting my call. Oh my God, that would be terrible because one day will come when I will be having no friends. So everybody should talk to me when I'm calling them. Or else they should connect me back or text me informing why they are not able to. This is terrible. So see, so many faulty thoughts the person is having. So therapist will be identifying these things and help the person deal and overcome this automatic thoughts that he or she might be having. Why? Because these are the thoughts. Because of these thoughts, I am feeling sad. I'm feeling low. I'm feeling irritated. I'm feeling depressed. And it is also going to affect my behavior. What am I doing? Ma'am, I'm not doing anything. I don't feel like doing anything. I'm feeling very low. I have, stopped replying to messages. If anybody is messaging, I'm not using my social media. I have also started to avoid people because I know they are not liking me. And then I'm complaining I don't have any friends. So it goes on and on in this way. So the therapist would be identifying these faulty thoughts and help me overcome those faulty thoughts and faulty way of thinking or interpreting or perceiving situations, and will be trying to broaden my thought process so that I can understand things from other perspectives, which previously I was not understanding. Then what will happen? It will bring about a change in my emotion. For example, my friend rejected my call. Now I'm like, yeah, she might be busy. Okay, if not, I'll later on connect with her to find out if everything is fine on her end or not. It's okay. So instead of feeling depressed and feeling concerned, what happened to my friend? So what would be my behavior? I'll check on my friend later on. Hey, everything is fine. Last day I called you, you didn't reply. Are you doing fine? So see, the entire scenario has changed. It's the same thing. Who helped me? The CBT therapist helped me. Now the point is, the CBT is, again, people think, oh, I don't suffer from depression. Why will I take CBT? I don't suffer from any personality disorder or any anxiety disorder, panic disorder. Why will I go for a CBT therapy or a detailed therapy? Again, these therapies are not exclusively for diagnostic category. I mean, someone who has received a diagnosis of some XYZ disorder. This is for anybody and everybody, be it clinical cases, be it non-clinical cases. For that also, we will be able to use these techniques beautifully. So why we are saying cognitive behavior therapy? Why not cognitive therapy? Because we are dealing with the client's cognition, thought process, as well as the behavior. For example, I'm trying to schedule the person's behavior, what time, what activity the person is supposed to do, how the person is going to grade his or her task, how he or she is able to rehearse some new behavior, how he or she is supposed to rate his or her behavior or develop mastery and pleasure by involving him or her in some kind of good behaviors, how he or she is supposed to manage to relax. So we can use it for low mood, depressive disorders, anxiety disorders, eating disorders, obesity, substance use disorders. So this is not only limited to this disorder part. The point is, if this can work on the wide variety of disorders, it can also work for non-disorders or non-clinical areas. Non-clinical means it is worth to be considered, but it is not that severe to receive a diagnosis. I'm feeling sad for a few days doesn't mean I'm suffering from depression. Depression is a clinical diagnosis. So someone who is diagnosed with depression, for that person also I can use. Someone who is feeling low for certain days because something has happened, for that person also I can use this. So that is the beauty of the therapy. And see, this therapy, it is not, helping a person to become dependent. Another thing is we can also go ahead with group therapy. Group therapy means it's a group of few clients but they're joining together and there is one or more therapists and together they're joining the therapy session. So yeah, in that way also it can work. So it's a form of therapy in which the therapeutic changes occur as a result of the interactions of patients with other patients and at least one trained professional therapist in the group setting. So when do we use this or how will it help? For example, like, okay, let me say this thing. When I was introducing myself, I mentioned that I have been working in drug de-addiction centers, rehabilitation centers. So there on a regular basis, I used to give group therapy. You know why? Because all the people who were admitted there in the rehab center, they were suffering from addiction cases. Similar cause, shared problem. So putting them in a group, so it is easy to address so many patients in a very small time. And also they feel like, oh, I'm not alone. There are so many people who are struggling with the same thing. And also they used to feel that, yeah, it is going to the correct years because they are also suffering from the same problem. Otherwise, people often think, ma'am, you will not understand because you have not gone through it. But here they are feeling that, yeah, we are kind of in the same boat. And in that same boat, there are few older patients also, but they are sharing their part. That, you know what, I was also experiencing XYZ and now I have been under therapy, under treatment, and I have overcome this. Today I am here. So listening to those stories, these clients feel empowered. They feel that, oh, that means it is possible. They feel motivated. They feel that, no, it's not something unrealistic. It can be done. One of you raised a question, some people always carrying negative thoughts about diseases. Will this coordinate with the therapy? How to overcome unwanted fear? Yes, there are various techniques with the help of which we will be able to address those faulty thoughts and fear or stressors or inappropriate way of interpreting certain situations. Yes, definitely through therapy, we can address health-related anxiety also. Next, not only addressing the patient, sometimes the entire family needs to be addressed. For example, a person suffering from schizophrenia, it's a major disorder. For example, a person who is suffering from major depression and the cause is the family. So you need to involve the family as well. Otherwise, maybe the treatment will become, partial treatment. So family therapy is based on the idea that the patient's psychological disturbance reflects a significant disturbance of his family. That is the disturbed patterns of behavior and the relations among his family members. So we can involve the family together and they can join for the session. So the therapy will be aiming at helping the family members gain insight into the problems and disturbed relational patterns and change their dysfunctional behavior and emotions into a healthier pattern. That's how it would be helping. So the whole focus of the therapy is that the family as a whole rather than the individual patient. So the family is viewed as a system suffering from dysfunctional problems or dysfunctionalities resulting from disturbed roles, relations among the members. So I'll just share a small case with you all. I have been dealing with patients where I have seen that they are suicidal. For example, talking about suicidal patients. Okay. So just one thing I would like to quote. A patient mentioned to the family members that, Mom, I'm feeling very sad. I'm feeling suicidal. I feel like giving up. I don't know what is happening to me. The family member mentioned, oh, stop all this drama. This is quote unquote drama. And you're doing all these things to gain attention. What do you mean by feeling depressed? You start participating in things. You think you feel happy, you feel happy. And after that, if the person or the patient was so much hurt, the patient took it as a challenge. Oh, you think this is drama? Let me die then. That means you are not even bothered about my health, my mental health, or my life. If I die, nothing will happen. That's why you are saying it's drama. and the patient actually attempted suicide. He was admitted in the hospital. On that day, I was on duty. I took up that case. So here, the family members must be involved so that they can understand what are the things that is triggering unhealthy behavior, or how they are knowingly, unknowingly contributing to the thing. So this is a very essential part. Without involving the family, it may not be possible to solve everything. Now, many cases we see marital problems. Like when I was also introducing, I mentioned I go ahead with couple counseling. Couple counseling means dealing with couples, pre-marital, post-marital problems, problems with infidelity, what we see extramarital affair, problems coming from relatives or societal stressors, a lot of other associated things. So for that, marital therapy can be of great help. This is again a form of therapy which is concerned with maladjusted marital couples. It aims at resolving the interpersonal and the related intrapsychic individual problems that the individual might be having as a couple. So the therapy is focused on the relationship rather than any of the individual partners. So how they can strengthen their relationship, how they can resolve on the conflicts, how they can deal with the situation. That can be there. Next, we can also go ahead with rehabilitation or rehabilitative methods. We also often call it rehabilitation counseling or rehabilitation psychology. So what happens here is, for example, a person was suffering from some major disease or something, very difficult, because of which the person got deviated from the mainstream. Now, after treatment and all those things, the person is finding it difficult to go ahead and adjust. For example, because of alcoholic disorders, because of schizophrenia, like major disorder, or many other things can be there, because of some accident, disability. So rehabilitation means to bring that person back to that mainstream so that he or she is able to well adjust and rehabilitate. So for that also, we can give them guidance, counseling, or psychotherapy. It is basically a management of the disability, handicaps resulting from psychiatric disorder or any other related disorder which is affecting at a psychological level now. And obviously by trained therapists. It is particularly important in chronic psychiatric illness. Just now we were discussing like schizophrenia, like mood disorders, like psychosis, like addiction cases. So we are helping them come back to the mainstream so that they are able to function properly. And how it is going to benefit them mentally and physically, mental health and physical health. It will aim at improving the patient's overall performance in different functional domains, like their personal hygiene, their self-care skills, their social interpersonal skills, their vocational or professional or work-life part, their educational part, their recreation activities. So we are rehabilitating them. So definitely this is going to improve the person's mental health as well as the physical health. Also, we can go ahead with milieu therapy. What is it? So an environment that is structured and organized to assist the patients to control and modify any type of problematic or maladaptive behaviors they might be having. So this is going to promote adaptive psychosocial, that means psychological as well as the social skills in coping with the self and others and the environment to deal better. So here the focus is on the social relationships as well as the occupational and recreational activities, which is going to achieve its goals in, it uses different therapeutic modalities, like we can put them in group therapy or different rehabilitative techniques or some kind of structured activities of daily living for all the patients if that got disrupted because of some problem. So this therapy is basically based on the coordinated work of a multidisciplinary team, which includes psychiatrists, psychologists, psychiatric nursing staff, social workers. It also includes occupational art, play, and recreational therapies. So we actually go ahead in a combined way. Okay, so as and when required, we can refer them. They can take the benefits, the professional in a professional way from those individuals as well. One of you mentioned, is hypnotherapy a part of psychotherapy? Hypnotherapy is also a technique. Here, we are not saying that it is a talk therapy like the therapies we have discussed here, neither like the behavioral or the cognitive part. In case of hypnotherapy, we are trying to get access to the unconscious state of the client's mind. So when we are talking about the levels of consciousness, now we all of us, we are conscious. Just beneath that conscious is subconscious. Beneath that subconscious is unconscious. So this is a technique with the help of which we are able to dig deeper in the unconscious state of mind, because it is believed that if there is any unresolved conflict in that part, it will affect the subconscious and the conscious, or it is going to come up in some faulty behavior or in a disease format or in some emotional problem or adjustment problem. So by resolving that, we are helping the individuals. So that is also a technique which is used by the professionals. So despite of so many positive things, there are certain limitations as well of the psychotherapy. So it is not possible to administer for uncooperative patient. If I am saying, no, I don't want to talk to the therapist, it will not work. This is not an injection like forcefully I'm going to push and anyway it is going to work. The person need to be cooperative and jointly we are supposed to take it forward. It is difficult in cases of clients with low intellectual capacity as to develop insight into the solution, and adequate intellectual capacities are essential so that they are cooperative, sitting and understanding and participating in the things. But overall, still we are seeing, say, there are more than, a lot of benefits that we can even expect from therapies if it's done in a proper way. So in today's session, these were the parts I wanted to cover. This is a very vast area. So I tried to put all the things almost, and I tried explaining it in the most easy format. So with this, we are done with discussing on what is psychotherapy. We have discussed about bursting the myths, the goals of psychotherapy, the techniques, the types of application, and how it is going to benefit us for our healthy minds and healthy body, and the limitations. So we can conclude by saying that psychotherapy is not simple advice giving. It is not something which can be done by anybody and everybody. It is to be done by a professional, and if properly done, we can also skip a lot of medicines, and we can also stop from developing some major mental or physical health diseases. Thank you, everybody. Thank you for showing an interest and your active participation. So I hope this session has benefited you. I hope to meet all of you again in some other course, internship, or workshop. Yes, I can see your hand. I'll take up. Yes.
Good evening, ma'am. Session is very beautiful
Thank
information
you.
we have got. And one question, little bit question I have. Can I ask?
Yes. Please go ahead.
Yes. Can therapist cure the issues or manage the issues? Sometimes counselor suggests the issue will be managed, but
Yeah.
here the therapist cure the issue or manage the issue. I am confused.
Yeah. So very important question being raised. So she is asking, can the therapist cure the issue or it can be managed? Now see, it depends on the problem. There are certain disorders where the disorder itself is not curable. So there we can use different techniques to help the person, how he or she can use those techniques to cope up and to deal and overcome those parts to the great extent. So we are not saying it's curable, but we are training you so that you can cope. And depending upon the type of problem, this is going to vary. We are basically equipping the person with various techniques with the help of which they will be able to cope and do. Okay.
Okay. Thank you.
Okay. Thank you, everybody. So you stay connected with the session. You are going to be guided about the certification.